My name is Macy Hunter, and this is my presentation on Virginia Henderson and her definition of nursing. Virginia Henderson was born in the year of 1897 in Kansas City, Missouri. In 1921, she received her first higher education from the U.S. Army School of Nursing, and then she furthered that education after receiving a bachelor's in science in 1932 from Teachers College at Columbia University. She remained at Teachers College to receive her Master's in the Arts, which she got in 1934. In 1934, she actually began a professor position where she resided until 1948 at Teachers College. In 1953, Virginia started the Yale School of Nursing, where as a research assistant, later reaching emeritus status until her unfortunate passing in 1996. Virginia was actually the first recipient of the Christiane Ryman Prize in June of 1985, which is the most prestigious award any nurse in any field can receive. Her theory really began in 1966, where she created her definition of nursing, later creating her 14 basic needs of the patient that are kind of interconnected with that definition. The key points of her definition, Henderson's philosophy can also be referred to as the need theory. Her definition is as follows. The unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery, or a peaceful death that he would perform unaided if he had the necessary strength, will, or knowledge. So her definition really focuses on doing anything for the patient that patient can't do for themselves. Henderson believed that the job of the nurse is to care for the patients until they are no longer in need, until they are able to perform those needs for themselves. Some more points of her definition. Along with that definition, she does have those 14 basic needs, as I mentioned before. And of those 14 basic needs, they are physiological, psychological, spiritual, and social. I thought this visual was very helpful in separating those needs as it compares it to Maslow's hierarchy. You can see it separates the physiological, the safety, the love and belonging, and the esteem as ranking. You can't have that love and belongingness without having all the physiological aspects mastered first. And of those physiological needs, some are very basic, like breathing normally, being able to eat and drink on your own, being able to use the restroom. And then some of them are what a few people wouldn't think of, such as being able to dress, being able to pick out your clothes, put them on without assistance, being able to bathe yourself, brush your hair, keep a clean outer body. And once the patient has those physiological needs met, then they may be able to reach the safety as well. And those are avoiding dangers in the environment, and not just their environment, it's avoiding the injury to themselves or others. On top of that safety is the love and belongingness, and these are some of the harder needs to reach. As you can see, one of them is worshiping according to one's faith, whether that be Christianity, Judaism, Muslim, maybe they're Buddhist, maybe they don't claim religion, they're spiritual, they like to pray. That's one of the needs that she includes. And along with that worship factor, she wants her patients to be able to communicate, whether that be emotions, maybe they're sad, their family isn't visiting them, they're hurting. She wants them to be able to tell her what they need, whether they just need their water refilled, maybe they need to use the restroom and they can't get up, maybe they're scared their treatment isn't working, maybe they're scared they don't have all the information that they want to feel comfortable. Anything like that, any emotion, big or small, negative or positive, she wants her patients to be able to communicate that with their nurses. And the final portion of these 14 needs are esteem, and these are going to be the last three patients are able to accomplish, and it can't be met until they have fulfilled all the physiological safety and love needs as below them. And of the esteem needs, one of them is working at something, providing a sense of accomplishment. In this, it sounds small, but no patient wants to be stuck in their bed all day. Maybe it's just a crossword. They finish a crossword and they feel like they've accomplished something for that day instead of just sitting there and waiting for their nurses to change their bedding, change anything for them. Another one in the esteem section is being able to play, being able to be active. As I mentioned before, none of the patients want to just sit there. They want that activity that people that aren't in the hospital can reach. And then the final one is learning, discover, or satisfy the curiosity. So this one is pretty simple. Um, Maybe they just need a class because, as I mentioned, the patients don't want to just sit there. They need that feeling that they are like the people not in the hospital. Benefits of Henderson's theory. Her theory is very easy to follow and is applicable to all fields of nursing, whether that be surgical, ICU, pediatric, cardiology. Any hospital or doctor's office situation can apply her definition and can apply those 14 basic patient needs. This theory makes it very simple for nurses to focus solely on their patients, covering all aspects of their recovery, not just focusing on administering medication, not just focusing on changing their bedding and their dressings. Finally, by defining her 14 needs, she made it very simple for people to see how diverse a nurse's daily duties truly are. Maybe one day the only need the patient can't meet is using the restroom on their own, and the next day they reach all those needs, but they can't be active. So it really shows how easy those duties can change. For the limitations to the need theory, although the theory is excellent and strong, there's not a clear way to link all the needs. Yes, you can group them by physiological, psychological, social, and so on, but there's no way, no chart or anything that says, well, if this need isn't met, then this need can't be met either. There's not one that says, if you lose this one, the patient's going to lose this one, and these are going to follow. Also, focusing on solely maintaining those basic needs can underestimate the value of medications because it is focusing on stuff the patient can't do for themselves, but maybe that medication can help them meet those basic needs. How can the need theory be applied to the care of patients? First, her theory can be applied by kind of using those 14 basic needs as a checklist. Sometimes it's hard to forget that patients do need to be able to worship. Maybe the nurse in charge of that patient is really focused solely on administering medication because they have a busy day for that shift. And this theory really makes it kind of easy to focus on all 14 aspects and not forgetting the safety instead of only focusing on physiological. Also, with the belief that nurses will do anything to make sure all of their patients have those 14 basic needs met, patients of all ages will prosper. Patients of all ages, race, genders, there's no grouping that can only be for this theory. It's universal. Finally, Henderson stated in a 1964 journal that she wrote that a nurse's job in caring for the patient is to do for that patient what they cannot do for themselves. This, as I said before, can be applied to children, elderly, middle-aged, anything. And this makes it very easy to see that the job of a nurse isn't just to do that medical aspect, it's to care for their patients, make relationships with their patients, kind of get a very personal relationship. I chose Henderson's theory because I found it very interesting that she places such a high value on those patient abilities. Previously, when I thought of nursing, I really did think it was probably 80% administering medication, changing beddings, changing dressings, changing gowns. And this really kind of opened my mind. I thought her 14 basic patient needs were very interesting because I myself would have only thought of the physical needs and maybe a few others. I wouldn't have placed the safety up there. It just wouldn't have come in my mind before I read and researched about her theory. I also chose this because her theory is very easy to follow. There's no tricking in her wording. It's very simple, it's universal, and it can be applied to any ages, genders, or race. and I want to work in pediatrics, so this could work for children, and if I changed and wanted to do geriatrics, this could work as well. Finally, I agree that those basic human needs are extremely important to reach and that nurses need to be able to see each of those patients reach those needs. And maybe the nurse is having a very busy shift, like I said before, but I do think it is very, very, very important for that nurse to be able to reach the same level of care for patients, for every patient, no matter how her day is going, no matter how bad she's doing outside of work. I think it's very important to leave that at home and focus on their patients to the best of her ability. And these are the references I used for my presentation. Thank you for listening.